Thank you, Howard. If your child is obviously bright and studying hard but not succeeding in school, there could be a good explanation. He or she could have attention deficit hyperactivity disorder. The question is, how is it treated? With us now is Dr. David Goodman. He's a professor of psychiatry and behavioral sciences at Johns Hopkins University School of Medicine. Doctor, thank you very much for being here with us. When we say this word, attention deficit hyperactivity disorder, what exactly are we talking about? What is happening to our child?
Well, this is a brain disease, and it's largely genetic. 80% of the cause is genetic. And the children show symptoms of lack of attention, impulsivity, hyperactive. They take longer to do tasks. They put things off. They're obstinate and resistant, but they can't focus, and they can't stay on a task, and they can't stay in their seat. Parents need to understand that this is not just a bad kid. This is a brain disorder that needs to be diagnosed and treated.
How difficult is it to diagnose? Putting all of the symptoms you just listed says that something else is wrong, but maybe one or 4 of those symptoms or 3 of them sounds like a child who just hasn't settled down, hasn't gotten into his groove. How do you know there's a disorder problem?
Well, and that can be confusing to parents because they say, well, my kid is just being a kid. But we're talking about a group of symptoms that are beyond just normal and that the teachers recognize. The teachers sit in a classroom with 30 children. They can tell Johnny who's daydreaming and throwing spitballs and not getting work done and forgetting his books. And that happens every single day. And the child does have those symptoms at home, so the evening hours are terribly chaotic and nothing gets done on time in an organized fashion. That's more than just a normal rambunctious child. It tends to run in families. So if a child has it, there's a good likelihood that one of the parents has it. And what's very exciting about this area now is that we know that attention deficit disorder extends into adults. So half of the children with the condition will continue to have symptoms after the age of 18.
At one point, we were doing stories where a lot of people say it was the catch-all disease, especially for boys, explaining their behavior in class. It was being overdiagnosed, medications overprescribed. But it also sounds as if we weren't paying attention to what these symptoms really meant a long time ago, if a child's parent could have had this disease and no one really understood it.
Well, that's very true, because a lot of these symptoms were chalked up to the child being lazy or unmotivated and disinterested and obstinate. Now we know that this is a real condition. Actually, if you look at prescription data in the last 5 years, only half of the children with this condition in this country are actually being treated, and less than 20% of adults with this condition are being treated. So the public impression is that it's overprescribed and overdiagnosed because the media is trying to get the word out that this is a real condition. But in fact, when you look at the research, actually a lot of people are going untreated.
Is it more boys than girls who are usually seen with this condition, or is it equal?
Well, that's an interesting question, because in children, the ratio is 3 boys to 1 girl, because a lot of the boys are hyperactive. As you get into the adults, it's 1 to 1 male to female, because a lot of the inattention children that didn't have disruptive behavior don't get diagnosed until in their teens or in their adulthood.
How do you treat it?
Well, you treat it with a combination of education, telling a person what this is, that it's not them so much as a brain condition, education, doing a lot of reading, talking to teachers, talking to counselors, and trying medication. Medication is actually very effective. 80% of ADHD individuals respond to medications, and the most common ones are the stimulant medications.
Is this something that can be cured using the medication, the behavioral, or is this a chronic disorder that will be managed over a lifetime?
Well, this is more like diabetes or hypertension. This is something that needs to be managed chronically over the course of a lifetime. However, it's not a stamp of impairment. I know a lot of successful people who've gone on to be very productive individuals. And so if your child has this condition, get them treated, set up the house in an organized program, talk to the teachers, get special accommodations, and encourage your child to develop their creative strengths.
Dr. Goodman, thank you very much. Good information.
You're welcome. Thank you.
Ahead on 9 News this morning, a step in the right direction.